Foundation, I would like to welcome you to our Common Cancer Foundation page. Our goal is to create an awareness of the challenges, support, and guidance experienced in managing cancer care for sufferers, family, carers, and friends. To engage with us, don't forget to subscribe to our channel. Click our notification bell. Good morning, everyone, and welcome to our final edition of the final edition 2022 of Kakaki Cancer Awareness, hosted in partnership with AIT. My name is Dr. Denise Ejo. Thank you for joining us. I think we've had a very, very interesting year, in my view. And first and foremost, before I even say anything, I want to say a shout out to AIT. Thank you for one whole year, January to December. You didn't fail us. Thank you for being our support and advocate at this point, because you've now become an advocate. Today is the last Sunday of the year, is the last Wednesday of the year. And we are starting, and we're ending the year, and we are grateful because it's had its ups and downs, as we will agree. So it's essential that we measure progress, we take stock. The year has had its own challenges, but let us all appreciate the milestones that we have had to endeavor throughout the year as patients, as family, as friends, as carers, as those who champion cancer advocacy. We want to say thank you. Thank you for being with us. Thank you for engaging with us. And thank you for sharing with us at different points. But I'm going to start by saying something. Dr. Adamu, good morning, and thank you for joining me. Can I hear you? Can you say something, please?
Yeah, hello, good morning.
Good morning. Nice to see you.
Happy holidays. Thank you.
Holidays? Oh, okay then.
Yeah,
okay, firstly, I would want to, and I'd like all of us to remember all those who really did fight a good fight, those cancer people and patients who really fought a good fight, those who are going through the cancer treatment plans at present, and those who have been diagnosed, and those who have just been diagnosed over the Christmas holiday. The principle is, together we fight, together we will win. And that's one thing I hope we'll all take into 2022. We'll also want to, above all, I want to really give a shout out to all the medical practitioners in the house, all those who watch us, who support this cancer, all the cancer patients. We want to say thank you to you. Thank you, because we couldn't have got where we are today. And so today, what are we talking about? We're going to be looking at reflections and the gains. Reflections and the gains. Who have I got in the house? The president of the National Cancer Society, Dr. Adamu Alhassan Umar. Thank you.
Thank you.
So I'm going to do a brief bio of our president. Dr. Adamu is the president of the Nigerian Cancer Society. As the president, he manages a broad portfolio in support of the Nigerian Cancer Society's advocacy priorities, with majority of his work focused on strategic integration and organizational alignment across the various cancer advocacy groups in the country. Thus, he is responsible for creating a nationwide public health advocacy organization that influences public policies at all levels of government. His primary responsibilities include overseeing strategy, organizational development and training, voluntary engagement, media advocacy, finance, governance, policy, public policies, and all the Nigerian Cancer Society operatives. We want to thank you, Dr. Adamu, for joining us. I haven't had you on this program this 2022, so it's quite nice to have you to come and talk us through how we have done as a community. And I'd always say the cancer space, we are a community, from the medical practitioners to the advocates to the carers, to all of you, everybody. We want to say thank you, thank you, thank you, thank you. Dr. Adamu, are you ready for us?
Of course I am.
You are. As always. So I think I'm done. Well done. Thank you for everything you do for the cancer space. We really appreciate you. So I want to start with a very nice, calm question, yeah?
Okay.
The year has been packed with lots happening in the cancer space across Nigeria for all Nigerians in Nigeria and in the diaspora. To this, we the survivors are eternally grateful, as I've already said, for all the stakeholders who are involved in helping us fight cancer. And every time I use the word us, I mean us, because I am a cancer survivor and I live with the disease. So all of us watching, thank you. So with this in mind, can you talk us through the year at a glance from all aspects, all aspects?
Yeah. Thank you very much. Merry Xmas to everyone, viewers, and of course, happy and prosperous new 2023 ahead. Let me start by truly thanking Common Cancer Foundation for the resilience, for the sustained energy throughout the year, in ensuring that there is consistency in bringing this program on air every month. And of course, the team at AIT, and the management of the station, the Africa Independent Television, for truly being there for the Nigerian cancer advocates and in ensuring that we have a timely delivery of this program every month. The consistency over there has been quite tremendous, and the awareness created has cascaded to all the nooks and crannies of Nigeria, because AIT is one of the stations that is being watched widely in Nigeria. So I say thank you on behalf of all cancer advocates. Well, the year has been quite eventful. We have had quite a number of engagements, and cancer advocacy is a continuous process. It's something that we do on the move. It's something that we do at home, something we do when we come out, and it's not actually something that is tailored to particular events or particular programs. It's something that you do in the bus. It's something that you do in the train, and in fact, anywhere you happen to find yourself, because awareness creation, like we keep on saying, is the bedrock, of reducing the cancer incidence, the cancer mortality that we have, the alarming statistics in Nigeria, because awareness creation will lead to early detection. It's only when people are aware that they come to the hospital. And of course, when cancers are detected very early, the probability of getting cured for most of them is very high. So early awareness creation, early detection, and of course, prompt treatment. So programs like this on AIT are truly, significant in creating that awareness. So throughout the year, we have had series and series of events across the nation. And of course, beyond the shores of Nigeria. We have been to activities from Lagos to Calabar, to Birnin Kebbi, to Maiduguri, to Yola in Adamawa State, to Damaturu in Yobe State, and Abuja. And in fact, almost everywhere across the country from the onset. Every month we have a particular cancer that we create awareness on. And the culmination of it all is the October, which is the Breast Cancer Awareness Month, where you have lots and lots and lots of activities. So like last year, or let me say this year, the year under review, it's a new year for another cycle of World Cancer Day activities. If you can see, I'm wearing a cap that says Close the Care Gap. We started the campaign for Close the Care Gap this year as part of the theme for the World Cancer Day 2022. And we started the year on a very good note. We had cancer advocates cutting across the various spectrum of our partners, our organizations. We paid a visit to the First Lady of the country, Her Excellency Dr. Mrs. Aisha Buhari, who is a very passionate cancer advocate. She has carried out a lot of cancer screening activities and interventions through her foundation, the Future Assured Foundation. And we paid her a courtesy call earlier in the year, around February. And we made some demands, part of which included the call for the national rollout of the human papillomavirus vaccine, which is a panacea to the elimination of cervical cancer in Nigeria. And of course, increased in funding and for cancer treatment and what have you. And it was a very, very good interaction, and we got her assurance. And we have been working alongside her office since then. And then, of course, like I said, various organizations have had awareness campaigns across the country. A lot of jingles, radio jingles, TV jingles, programs like this that are consistently on air, reminding people on the dangers that this dreaded monster called cancer can bring, and the need for early detection, which is very key to survival, positive survivorship. And of course, October being the ultimate month of cancer advocacy was when we had activities basically from every nook and cranny of this country, because of all our partner organizations were engaged in one form of activity or the other. Lecture series, awareness creation work, marathons, and a lot of activities. And of course, October was the month that culminated in the World Cancer Congress, where we were in Geneva, Switzerland. And I'm happy one of our frontline champions, Dr. Denise Ejo herself, was in Geneva live. And of course, Nigeria being a very strong cancer advocacy country was the highest from any African country in terms of attendance at the World Cancer Congress in Geneva. And of course, it was at that same Congress that we had our very own Her Excellency Dr. Mrs. Zainab Shinkafi Bagudu, the First Lady of Kebbi State and the founder of Medicaid Cancer Foundation. Imagine, as a second-term board member, she actually contested for the presidency, and it was a very keenly contested election, alongside a Swedish woman and another Japanese guy. I think the Swedish woman won eventually, but Her Excellency was equally elected as a second-term board member from an array of nominees. And so Nigeria is in the front line of cancer advocacy, not only in Nigeria, but of course across the globe. November, which is just last month, was the month where we gathered all cancer stakeholders from all over the country, and in fact from the diaspora to Abuja, where we had the International Cancer Week, which was a creation of some cancer advocates, staunch cancer advocates, people like Professor Ifoma Okoye and the rest of them, and spearheaded by the Federal Ministry of Health. We had the largest gathering of cancer advocates in Abuja, where research papers were presented, where survivors had the opportunity to talk. Dr. Denise Ejo was a panelist on one of the panel discussions that took place during that very week. So it was a 5-day packed full of activities where cancer advocates, cancer survivors, specialists come together to exchange ideas. And it actually culminated in the, the annual general meeting of the Nigerian Cancer Society at the end of the week, where he was elected alongside other executives for a second tenure of 2 years. And members tagged the next 2 years as a consolidation phase so that we can build and consolidate on what we have built over the past 2 years. Unfortunately, for us, the year ended on November, the activities of the annual general meeting ended on a sad note, because we lost our vice president of the Nigerian Cancer Society, Comrade Elijah H.O. Elijah, who had an accident while he was traveling back to his family after the annual general meeting. But his death was a motivator in itself to us, because this is someone that has spent over the past 30 years in the advocacy space, from HIV to cancer. And this is somebody that died while carrying out the thing he loved to do the most. So it should be a drive, it should be a motivation for us to do more. And of course, as we get towards 2023, like Dr. Dennis has said, the year has been packed with activities, and we are still looking forward to a more robust 2023 so that we can consolidate on the gains we have recorded this past 1 year.
Thank you. You've been able to give us a broad outline of how we did. I think that's very nice. Well done, and well done to all the cancer advocates across the country, all the specialists, all of you. I'm going to ask you, and I want you to very point, not over-explain, because we're going to use it to measure next year. So, you see, I'm a teacher. So whenever we do things, we have to be able to measure progress. And I want to measure next year. As you will appreciate, I am a survivor and a serious advocate. You know that. So what are we expecting, or rather, what are the plans Nigerians should be looking out for in line with the global trends? See, so you see, I don't want to use English to confuse us. All of us here, we want sports. So we're going to come back and say, Dr. Adamu, you promised that we will get past this. Even if it's only 3 points, it's better to say 3 than to give me 10, and then I come back, because this is recorded and I will keep it.
Yeah. So thank you very much. Let me say 2 or 3 things before I say the 3 things. Firstly, we now have a new act that is called the National Health Insurance Act. It was National Health Insurance Authority before, but it's National Health Insurance Authority Act now. In that act, it makes health insurance compulsory on all Nigerians. It's not voluntary anymore, it's compulsory. And again, government has a great deal of money to cater for the vulnerable age group in that act. Now, another thing is, again, we have a new system or a new approach at the Federal Ministry of Health, the National Cancer Control Program, where there is more interest now. Just recently at the International Cancer Week, it was announced by the Permanent Secretary that from the 3 most commonest cancers, we will be looking at increasing the number of cancers to cover under the Cancer Health Fund. Again, from the 6 hospitals, 1 in each geopolitical zone, they are adding 1 more. 6 hospitals were the pilots. We are adding 1 more. Now, these are good developments for us in the cancer space, because whatever we do, we look at what the infrastructure we have on ground. We look at the resources to cater. It's not just about making the noise to provide care for all cancer patients, but are the resources on ground. The third thing I wanted to mention is the fact that we have the private sector now that is interested in cancer, that is bringing about a lot of innovations in cancer. We have state-of-the-art machines, specialists coming all the way from even America, UK, and the rest to come and cater for our cancer patients. So we are optimistic. Now, 3 things to expect in the year 2023. As a cancer advocate, let me say that you should expect a massive advocacy and awareness creation on cancer that has never been done before or has never been experienced before. That's 1. Because we are going to maintain this momentum. We are going to consolidate on this momentum so that we can cover enough grounds. Secondly, you should expect a greater synergy and coordination of all cancer organizations in Nigeria. Because the bottom line is, if, like when you started with Together We Fight and Together We Will Win, when everybody is under the same umbrella, working together towards a common goal, you can imagine the impact. So expect that in the coming year. And of course, you should expect that there will be greater intensity of advocacy to policymakers. We will continue to disturb them. We will continue to make noise. And we will amplify this noise through programs like this so that the policymakers will hear, so that the rightful thing, the needful will be done in order to cater for cancer patients. So be rest assured that with the support of everybody on board, 2023 is going to be a glorious year for cancer advocacy.
You know, I've told this, and now it's all target points I'm going to go after you with. The next one, when are we going to be in a position to have reliable data that informs planning? So you see, I'm using that very carefully because how much of our data is being recorded in respect of the different cancers in the villages, because awareness is far behind. So how are we going to do that? Because we need reliable data to be able to really plan. That's a very quick one. I just want I don't want too many promises. I want very simple, sharp.
That's very true. And like I always say, for every one cancer patient, you see there are hundreds out there because of lack of data, because it's only that person that comes to the hospital that gets captured. Now, let me say this, as an advocate and for someone that has been working very closely with the National Cancer Control Program at the Federal Ministry of Health, I want to say that the new method or the new modus operandi of carrying out the activities of the Nigerian Cancer Registry, which was relocated from Ibadan to the Federal Ministry of Health. And I'm aware of a circular that went out to all tertiary health institutions in Nigeria, not only tertiary health institutions in Nigeria, but every tertiary health institution, whether state or federal, that treats cancer. There was a circular for them to establish a cancer desk. There was a circular for them to establish a multidisciplinary team. Now, this is where the source of this data comes from. And be rest assured, in my hospital where I work in Yobe, they have a cancer desk and they have a multidisciplinary team. And be rest assured, everything is now on record. And that is what we need, because like you said, data is the ingredient for development. Data is the ingredient for research. And data is the ingredient that will eventually lead to interventions. So it is our belief that with this robust system in place, and with when Federal Ministry of Health ensures sustainability, adequate training of the personnel that will man these registries, by the grace of God, in the next couple of years, we'll be talking about our data, locally generated data being quoted globally. Not that we will be quoting global kind statistics while we're here in Nigeria, and it will be telling us statistics of 2020 or 2021 while we're already in 2023. So it is our belief that the trend will change. And then,
I'm holding you on all of this.
Yes. We are coming back December next year to talk about it.
Wow, I'm glad we are getting the plan. Okay. Big ones, because as we're getting to the end of the year, it's very important. I want to say, can you give me 3 points or 3 main things that can you guide a cancer patient on how to seek help in the new year? Just very specific, very quick, very sharp, because we know we won't remember, but we know that it's
Well, it is very important to know that a cancer patient is someone that needs the attention of everybody, the community, the family, advocates, everybody. So it is very important for a cancer patient to identify himself with a group that has some, basic understanding of what the person, he or she, is going through. So it is very important to get linked up to someone or an organization that works on cancer. Even if that organization is not going to help you financially, it will give you a guide as to where to go. For example, in the Nigerian Cancer Society, we have a platform we call the NCS Champions Hub. It's a group where we have cancer survivors, people that are surviving cancer, like Her Excellency Dr. Dennis Ejo.
I'm not on it. I'm just about to complain.
So you're already on it, man. So where you have is like a cancer survivorship group where you have people that are suffering cancer, you have people that have similar cases with their own, you have people that will share their experience on another thing. This is where you get information on, for example, the Cancer Health Fund that is established by the federal government that caters for the 3 commonest cancers in Nigeria: breast, cervical, and prostate. Now, so like I say, we may not have money at hand to cater for cancer patients, but there are modalities where you can come close. For example, just last month during the Cancer Awareness Month, Walk Away Cancer, organized by Her Excellency's Medicaid Cancer Foundation, she made an announcement at that event that the Medicaid Cancer Foundation has earmarked the sum of 50 million naira to be co-managed by the Medicaid Cancer Foundation and the Nigerian Cancer Society to cater for indigent cancer patients that cannot afford to pay for their treatment. And of course, part of it to go into research, because research is the bedrock of development, like we say. So the bottom line is, don't hide, come out for screening, get screened. If you are detected early, get cured. And of course, if you have an advanced disease, don't lose hope. Come close, get an NGO that works on cancer, come to the Nigerian Cancer Society, go to Common Cancer Foundation. Our social media handles are open to the public. They are out there. Get in touch, and then, of course, renew your hope to live, renew your hope to survive, and live positively by impacting the lives of others.
Okay. And then close up, getting ready to finish up now with you. I want you to give me 3 things that we're going to, we want to see. Now, I want a particular thing for government and a particular task for the government. I want a particular task for private sector. I want a particular task for NGOs. So we were NGOs. So
yes.
And we are very, very close. We work very sharp together. So you tell us your own.
Well, let me start.
Not too many stories about it, because Dr. Adamu, we will forget what you are saying. We don't want to forget. We want to be very precise.
Let me start with the cancer advocates, cancer NGOs. Engage in research. Engage in research and community engagement. Very important. These are key cardinal things that will yield results for us in the cancer advocacy space. For the private sector, diversify. If you look critically, Lagos is lucky. Abuja is lucky. Calabar may be lucky. But is my state capital of Damaturu lucky to have a standard, sophisticated private cancer facility? No. Is there a sophisticated cancer facility in Sokoto? No. Is there a sophisticated cancer facility even close to Abuja in Lokoja? No. Private sector diversify. The market is there. Nigeria is the most populous country in Africa. When you diversify, the turnover will be there, and there will be return on investments. We need sophisticated cancer centers in Yobe, in Sokoto, in Calabar, everywhere for the private sector. For government, we will continue to make noise. In 2023, the noise will be much more louder.
Thank you.
Why? Because we need budget for health to be increased. We were lucky from 5%, we are on 8% now, but this 8% is general health budget. We want to achieve the minimum standard of the 15% consolidated budget to health. Without that, we cannot go anywhere. We need further increase in sin taxes, pro-health taxes, taxes on sugar and sweetened beverages, taxes on alcohol and what have you, so that these taxes can be channeled to health. We will continue to make that noise. And that is our call on government, policymakers, increase budget for health. Thank you.
Thank you, Dr. Adamu. Thank you for them talking to us. Thank you, because I love this AIT. Awesome. You have actually really done us good this year. So to all our sponsors, AIT family especially, see, you are our sponsor, you are a key sponsor on this thing. AIT family, with you, we are saving lives. You may not realize it, but the more the message goes out, the more we're able to get out to a lot more people to know you can actually seek help, and there is help. We appreciate you, AIT. We appreciate the team. We appreciate all of you, our director. We really, really appreciate you all. To our followers, thank you for sharing the cancer awareness programs around and talking and sharing your own experiences. It's not about Cornwood Cancer Foundation alone. It's about all of us as a community. So we want to thank everybody for supporting each other and supporting those who really, really need our help. I want to say we have a very good lineup now starting 2023. So just watch out, watch this space. AIT are already ready for us. And you know, World Cancer Day is in February. That's another big time for us. So let us all start planning what we're going to do to make sure that the people, that Nigerians get to feel that the cancer community is growing and we are actually making a difference in society. I want to say a very big thank you to every single person who is with us on this, who watches this, who watches our programs. Follow us on our social media pages, Cornwood Cancer Foundation. Share, subscribe, click the notification button, because you see, once you share our message, other people look for those around. If you want to have cancer in Ondo, go, you will find the help there. If you're in Oyo State, you will find help there. Don't worry about it. Just seek help wherever it is. And I believe that we're getting together, Dr. Abadamo, am I correct? We are getting together the list for all Nigerians to be able to find the nearest hospitals to them. Is that fair?
Yeah.
I want to say a very big thank you to you. Anything to close, because I'm about to finish up now. You're good?
I just want to thank AIT for converting our very own Dennis Ejo, PhD, the staunch cancer advocate, into a journalist. So thank you.
Would-be journalist. Oh my God, that's a new one. I don't think I want that job. I want to thank you all, AIT. I want to thank everybody. Thank you for joining us. Thank you for working with us. Thank you for 2022. And now we look forward to 2023 and pray to God that we all live to go and celebrate another year as a cancer patient. Trust me, I'm still here 6 years on, going into the 7th year. I am looking forward to it. So I hope that you will. And I'm going off now to take chemo. So I want to thank you and have a lovely year ahead. End 2022. Happy New Year in advance. Thank you all.
And we love you.
Thank you, AIT.
All right, those thanks expressed there, quite appreciated. And we thank you, Dr. Dennis Ejo. You wouldn't know how far you have impacted the lives of many out there, both in Nigeria and elsewhere around the world. Great job you've done for the whole year. The consistency, you know, the guest analysis and everything has been quite interesting. And I believe that 2023 will get better. Thank you so much for all you do. And we wish you the very. In fact, I was just telling Adora when you came on that like, you look so beautiful.
You're glowing.
You know, really, as always. So we wish you the very best, and please do stay safe and enjoy yourself. Have a wonderful day.
Keep warm.
We'll see you again next year.
Bye-bye.